Now let's pick up on a few recent matters relating to COVID-19. We know that sharp increases in traces of the virus have been picked up in wastewater in parts of the Western Cape, Limpopo and other areas in recent weeks. But how worried should we be about this? I'm joined now by Wits vaccinologist Professor Shabir Madhi. Prof, always great to chat to you. Clearly COVID is doing the rounds, and this wastewater monitoring is a good indication that it's on the increase. Is it an early warning, or is it something that tells us where we're at currently?
Good evening, Sally. So it certainly tells us that there is an increase in transmission of the virus in different provinces, and particularly in the Western Cape and Gauteng, as well as in Limpopo. So it is an early indicator that we can anticipate for there to be an increase in number of hospitalizations as well. And there has been an uptick in number of hospitalizations, at least in Gauteng and the Western Cape. But at the same time, I think what we can expect with this, if there is a resurgence upon us, is that it's very likely will be similar to what we experienced around about April, May, with a BA4, BA5 variant, and that it will be for a short period of time. And those individuals that will be most affected, obviously, are unvaccinated individuals, and particularly if they're above the age of 55, 60, or if they've got underlying medical conditions.
Now, we do know that I think at least 80% of the South African population is believed to have immunity, either through vaccinations or having had COVID, or a combination of both. Is there any chance of that immunity waning, or will our T cells keep us safe for many years?
Yeah, so it really depends on what you're trying to protect against. If you're trying to protect against a mild illness, then unfortunately both infection-induced immunity as well as vaccine-induced immunity is relatively short-lived, because as you mentioned, you've got this waning of antibody, and that translates into lower protection against being infected by the virus or developing mild illness. But the underlying T-cell immunity certainly assists us in having more durable protection against severe disease. But at the same time, people above the age of 65, and again, those with underlying medical conditions, both past infection as well as past vaccination, especially if that vaccination has been more than 4 to 6 months before the onset of the resurgence, it's inadequate. So they need to get boosted doses of vaccine, be it the third or even the fourth dose. And again, to mention, particularly if they're above the age of 55, 60, or if they've got any other sort of underlying medical condition, they still do remain susceptible to developing severe disease, although less so than if they had absolutely no immunity.
So when is the best time to get a booster? I mean, in my case, I've had 3 jabs. I can't remember when I had my third. How many months should I be waiting between my third and my fourth? Or does it depend on when you hear there's a resurgence, go and get a booster? What's the advice?
Yeah, absolutely. So the best time to get the boost is when there's a signal of an uptick on the number of cases. So now would be a good time to get a boost if you're wanting to enhance your protection against mild COVID. But again, for me, that's not really the important focus. Focus has to be about protecting against severe disease. And in that case, again, people above the age of 55, 60, or those with underlying medical conditions, if they've received their last vaccine more than 4 months ago, they would be well advised to get a booster dose now.
All right. I wonder if you could help us understand, because I think that essentially what's happening now is COVID-19 is taking its place amongst other viral infections, and we're doing a sort of risk mitigation, and how worried should we be? How much do we put on hold? So if we look at sort of hospitalizations to a typical flu, is COVID still seeing higher rates of hospitalization, or is it on a par, or is it lower?
So it's a difficult head-to-head comparison, but what the data does show us, and this is already the experience early this year with the Omicron variant, there's something known as the infection fatality risk, and that is what percentage of people will die if they are infected with the virus, not if they end up in hospital. And we've been able to do this calculation for the Omicron BA1 variant, and the infection fatality risk with the BA1 variant is very similar to what we experienced for seasonal influenza before the onset of COVID-19. So we're very much in a ballpark of COVID-19 being probably as severe as seasonal influenza is. Perhaps a bit too early to be definitive about it, because it will be good to see what happens during the course of the resurgence that probably will start in the next few weeks in most of South Africa. But I would say, yes, we're probably now seeing COVID-19 having a similar sort of risk of ending up in hospital as well as dying compared with seasonal influenza in a country such as South Africa, where there's extensive amount of infection-induced immunity together with some vaccine-induced immunity.
I see. So, in other words, the reason we won't see the levels of dying and that we saw at the peak of the pandemic is because of the immunity factor that's now come in. So it's sort of neutralized it to a level of around flu. I wonder if you could just give some advice. You have mentioned that if it's 4 months since your last booster and you are in that higher risk category, you should consider getting a booster, and generally bearing in mind we're seeing a resurgence now. What other advice do you have for people who might be high risk? Should they start wearing masks again?
Look, it's very much an individual decision. Certainly people that are immunocompromised, they wouldn't be advised to go into indoor spaces where there's many other people, particularly since very few people are wearing masks nowadays. So I think people need to start doing what they believe is the necessary precautions they should take. But at the same time, I think the minimum that they should be doing is getting a booster dose of vaccine if they are at high risk of developing severe disease. But for the rest, we're probably now in a space where we need to start thinking of COVID-19 in a similar sort of framework as we think about seasonal influenza and other respiratory viruses because of the way the virus has evolved and the way immunity has evolved in communities.
All right. Thank you so much for chatting to us this evening. Wits vaccinologist Professor Shabir Madhi, confirming that, yes, there is a resurgence coming. Time to get your boosters if you haven't had them, and be a little bit more cautious if you're in a high-risk group.